Good afternoon, Miss Bertha. May I come in?
Yes.
Hi, Miss Bertha. So nice to see you again. Hi. Miss Bertha, my name is Brenda Jimenez, and I'm an occupational therapy assistant student with Austin Community College. I'm going to go ahead and do my hand hygiene here before we begin. Miss Bertha, would it be okay if I had a seat here with you?
Yes.
Okay, great. All right. So, Miss Bertha, for your safety, can you give me your date of birth, please?
2/21/1960.
Okay, great. Can I just look at your band there? I just
Yes.
want to. So nice to see you today, Miss Bertha. I understand that you had a fall. You fell, you lost your balance, it seems like. Does that sound right?
Yes.
Looks like you also broke your wrist.
Yes.
Yeah. Are you right hand dominant, Miss Bertha?
Yes.
So it's probably making things hard for you to do things with your left hand, right?
Yes.
Yeah. Well, would it be okay if I told you a little bit about why I'm here today?
Yes.
Okay, great. So I'm really sorry that that happened to you and that you fell. The reason that I'm here today with you is I'm going to do a couple of things. We're going to start off with an assessment, and it's called the Functional Reach Assessment. You've done it once before. You probably remember it. We want to check that dynamic standing balance, and all that means is that balance that you need to be able to do things like reach for your yogurt or be able to go to the bathroom. The assessment that we have in place, it's just right over there, a couple steps from us. And I'll be with you the entire time, and I'll be guiding you. It's going to give you, I'm going to give you a trial run, and then we're going to do the assessment 2 more times, okay?
Okay.
I wanted to also tell you that I have reserved the kitchen space today, and since it's right around your lunchtime, I was thinking it would be a good idea for us to do an activity where you prepare your own lunch plate. So I've reserved the area, and we've got a lot of yummy lunch items laid out for you. And we're going to be working together on you standing and serving your own lunch plate, okay? How does that sound?
Good.
Okay. I already checked our environment in the kitchen. Everything looks really good. I made sure that there was no spills on the ground. There's no debris anywhere. I'm also looking around your room right now, and everything looks really good. There's no cords or any chairs or anything that would get in our way, okay, as we work on our environment, through our environment. Miss Bertha, do you use a cane to get around when you're at home?
Yes.
So I noticed that it's here next to you. We're definitely going to use that as we move around today, okay?
Okay.
All right. And then I wanted to ask you a couple of things before we get started. Did you already have breakfast this morning, Miss Bertha?
Yes.
Okay, good. And I checked with your nurse, and they did check your blood sugar this morning, and the numbers look really good. So we're able to work together today, okay?
Okay.
I wanted to ask you about your pain rate. I needed to find out from you how you're feeling. On a scale of 0 being no pain and 10 being an extreme amount of pain, where would you rate your pain, Miss Bertha?
I too.
About a 2?
Yes.
Can you tell me where your pain is located?
On my left shoulder.
On your shoulder? Okay. All right. Well, during our session, I don't want to put you, like, I don't want to have that pain skyrocket or anything like that. I need you to tell me, okay?
Okay.
If it starts hurting too much, and we can sit down and have a break, or I can come back and work with you later, okay? I know you have osteoarthritis pretty bad in your knees. How are your knees feeling today?
Okay.
They're feeling good? Okay. All right. And then I also wanted to check in and let you know that I want to check your vitals before we get started, because I know you have hypertension, right? You have a little bit of high blood pressure.
Yes.
So I'm going to be checking your blood pressure as we go through our session to make sure that it is within therapeutic range, okay? All right. I'm going to get these gloves on my hands, Miss Bertha, because I want to make sure that I'm not bringing any additional germs to you, okay?
Okay.
I'm wearing my face shield, my face mask. I've already done my hand hygiene. I just want to make sure that I keep you nice and safe. I appreciate you wearing your mask too. That's very thoughtful of you. We want to make sure that we're both really safe during our session. I'm going to get a gait belt around your waist before we stand up together. Because you lost your balance and you had this fall, I'm going to be you getting kind of close to you and helping you to stand up. And we'll just do it slowly and work together. How does that sound?
Sounds good.
Okay, great. So let's go ahead and get your vitals checked. Are you ready to get started with our session, Miss Bertha?
Yes.
Okay. And do you have any questions for me?
No.
Okay. All right, let me go ahead and clear our environment, and let me go ahead and get your vitals checked here. All right, so let's go ahead and get these vitals checked. Relax your left arm. Okay. All right. Okay, good. So the number looks really good. It's within therapeutic range. And like I said, I'm going to check it again 2 more times during our session, okay?
Okay.
So are you ready to walk on over to our assessment site?
Yes.
Okay, great. Let me get the skate belt around your waist. Just lean forward just a tiny little bit for me. Thank you. I'm going to try not to nick your or touch your left, your right arm, because I know that you're in pain, and I don't want to cause any additional pain. All right. So this chair that you're sitting in is a perfect chair because it has some nice armrests on it. And I noticed that you're wearing non-skid shoes, and that's a perfect shoes that you should be wearing for our activity today. And as you're standing up from a chair, it's important to wear shoes that you're not going to slip on, okay?
Okay.
I want you to start using these armrests to really help you as you're going up. We want to start using that left arm more and more because you don't have use of your right arm right now, right? So as we're going to stand up, I'm going to talk to you about really pushing down with that left arm. Let's get that back of that arm strengthened up, okay? Because it's going to need to do some work, right? All right. Well, let's go ahead and get started. Do me a favor. Can I get you to use your left arm and bring your hips towards me just a little bit? All right. Okay. Now bring your knees behind you just a tiny little bit. And I'm going to get right between, I'm going to use my legs to get in between your knees. And I want you to use that left armrest, or that armrest, and I want you to lean into me just a tiny little bit. And at the count of 3, we're going to stand up together. Are you ready?
Yes.
1, 2, 3. Push up, stand. Okay. How are you doing it, Miss Bertha?
Can you hold on to me, please?
Hold on to you. I got
Yes,
you.
I'm
I got
on
you.
balance.
Okay. I have you right here, okay? All right. All right. Let me go ahead and grab your cane. Right here. All right. Let me get this cane to you in your left hand. You doing okay there?
Yes.
Okay. Let's go ahead and walk on over to our assessment site. Take your time. Very nice. And I want you to stand with your shoulder right at the corner of that yardstick. That's perfect. I'll take your cane from you. All right. That is perfect. So I'm going to be right here with you the whole time, but I want to get it out of your way. I want your feet, that's a perfect position, very comfortable, shoulder width apart. So let's give this a trial run. I don't know if you remember how to do this, but I want you to bring your arm to about shoulder, 90 degrees, about shoulder height. So raise your arm, and I want you to make a fist. Perfect. All right. So these are your instructions. I want you, without touching the yardstick or any other surface, I want you to reach forward, and I don't want you to step, okay? Let's give it a shot. Trial run and relax. How are you doing there, Miss Bertha? Do you need to take a break or anything?
No.
Okay. Let's go ahead and do the test number 1, okay? You ready?
Yes.
One more time. Go ahead and raise your arm to about shoulder height, 90 degrees. That's perfect. Lean forward as far as you can, and no stepping. Perfect. And relax. You doing okay there, Miss Bertha?
Yes.
Okay. All right. We've got one more shot, okay? Ready? Raise your arm to about 90 degrees. Perfect. Make a fist. All right. Lean forward. No stepping. All right. You did that so nicely. How do you feel?
Good.
Feel okay? All right. I'm going to come around you, and I'm just going to go ahead and hand you this cane. I know you feel a little bit. Let's go ahead and have a seat. Okay? And I'm going to go ahead and make sure that I get you sitting back down nice and safely. Let's start turning your body. I want to tap your right arm there because I don't want to hurt your wrist. Let me take this cane from you. All right. And so let's do this together. Once again, I want you to reach back with your left arm. Reach back, lean forward just a tiny bit, and let's go ahead and sit at the count of 3. 1, 2, 3, sit. Okay, how are you doing there, Miss Burke? Are you doing
Good.
okay?
Yes.
Okay. All right, you look really nice and safe. Your feet are flat on the floor. Okay, give me a second. I'm just going to write down our assessment. All right. Perfect. I want to check in with you, and I want to check your vitals really quick before we move on over to our activity, okay? Beep, 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 beep. Relax your left arm there. Perfect. Okay. You look really good. How are you feeling?
Good.
Okay. All right. Are you ready to stand back up and walk on over to our activity?
Yes.
I'm working you today, aren't I?
Yes.
All right. Let's go ahead and get started. I wanted to mention that because you've been having problems with your balance, I'm going to go ahead and bring this chair on over and get it really nice and close to our activity. I'm going to have it here just in case you might lose your balance or if you need to have a rest. It's just going to be right here for us, okay? All right. So let's go ahead and stand back up together. Once again, use your left arm and bring your hips closer to me. Okay. Put your feet back just a tiny little bit. Now I'm going to get between your legs there. And at the count of 3, Miss Bertha, lean forward just a little bit. Let's stand up together. 1, 2, 3. You doing okay there, Miss Bertha?
Yes.
Okay. All right. Hang on there for me. Let me grab this cane for you. And let's walk towards the kitchen. Okay. Do you see your lunch tray there?
Yes.
All right. Let's walk towards that lunch tray. Mind that chair next to you. All right. And I can hold on to your cane for you if you'd like. So what I want you to do is I want you to take one step closer. Perfect. All right. You see all the yummy lunch food you got here?
Yes.
Okay. So whatever you'd like to serve on your plate, let's go ahead and start working on it. I really want you to try to reach for the items. Kind of move that weight between your left and your right. Oh, I love that. Beautiful. Working on that dynamic standing balance. Perfect. Go ahead and serve. That looks like some yummy tuna. Miss Bertha, I understand you have a little bit of you have a mild case of macular degeneration?
Yes.
Okay, I wanted to show you kind of a technique. Go ahead and pick up that tuna bowl if you don't mind. Bring it close to your nose and close your eyes. Perfect. How's that smell? Does it smell good?
Yes.
Okay. That's a good technique for you to use to keep you safe once you're back home. So if you're having trouble with your eyes, if you're experiencing blurriness, or if you're having trouble looking at things, smelling them is a good way to keep you safe. And so you want to smell the food that you're going to eat before consuming it. Okay?
Okay.
That's just a cool technique. All right. Would you like some yogurt, Miss Bertha?
Yes.
All right.
It's too far. I can reach.
You can't reach? Well, what do you say? Why don't we slide on over a little bit more tonight? Let's try that. Perfect. Try it now. Was that easier?
Yes.
Okay, perfect, perfect. All right, do you want to grab some carrots or anything?
Yes.
Okay. Tall your posture is. You've got great posture, Miss Bertha. All right. Anything else that we need for your lunch?
Yes. Some napkins.
Some napkins, okay? All right. Anything else?
Silverware.
Okay. Some silverware, nice. Okay. All right. Anything else that you need?
Yes. Some ranch.
Okay. Looks like a yummy lunch plate.
Yes.
All right. Are you ready to have a seat, Miss Bertha?
Yes.
Okay. Let's walk on over. Let's go to your left side a little bit so we can get closer to your cane. How does that sound?
Good.
All right. Okay, perfect. we're in a perfect position to reach for your cane, and I'll hand that to you. Right, we always want to use your cane, right, when we're in your
Yes.
environment. All right, let's go ahead and start turning your body, and let's go ahead and make our way back to the seat. All right, and start turning your body. Perfect. You come around here. I'll take your cane from you. Let's do this together, okay? All right, so reach back with your left arm. Do just a little bit, and let's 1, 2, 3. Count to 3. Let's sit. You doing okay there?
Yes.
Okay, great. All right. All right. Let me go ahead and get this gate belt from around your waist. I don't want that too tight on there. I'm going to bring your lunch tray to you, but I want to talk a little bit about how our session went. Would that be okay? Okay. Let me pull this chair up here just a before we do anything, Ms. Bertha, I want to check in and find out how your vitals are doing, okay? All right. Beep, 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 beep. Okay. They look really good. Still within therapeutic range. All right. So I wanted to find out from you, your vitals are good. I want to talk to you about pain though. I need to see if you can rate your pain for me once again on a scale of 0 to 10. 0 being no pain and 10 being an extreme amount of pain. How would you rate your pain?
3.
Okay. All right. About a 3? Okay. So it went up just one number, right?
Yes.
Okay. Let's talk about that for just a second. Let's go ahead and do me a favor. You're in a perfect sitting position. You've got excellent posture. Your feet are flat on the floor. Do me a favor and close your eyes, Miss Bertha. I want you to take a deep breath in. I want you to use that breath and use it to fill up your abdomen. And now go ahead and release it. Really feel it as you're letting that air go. Okay. Can you do that 2 more times for me? And you can open your eyes. This breathing technique that I just showed you, Ms. Bertha, sometimes when you're having pain because of this trauma that you just experienced, your broken wrist, if you're having that pain, take a moment and see if you can go ahead and just take in a couple deep breaths. Sometimes when we have more oxygen in our blood, it makes us feel better, and it brings those pain levels down. It can ease that pain. And right now, you're going to do something that's, important, which is eat. So we don't want you in a bunch of pain while you're trying to have your lunch, okay? So that's just something that can really help you to help with your pain, okay? I wanted to tell you that I'm going to come back and see you again tomorrow. I think you did really great during our session today. We really worked on your dynamic sounding balance. The first time we saw you, you were only able to reach to 4 inches, and today you were able to go as far as 8. So that was very good. As we were standing here at the kitchen area, you were able to reach for items. You weren't able to reach for the yogurt, but we were able to move ourselves carefully to the right, and you were able to grab for that yogurt. So I did notice that your pain, does increase as your activity increases. So that's something that we'll continue to work on, okay? I'm going to see you tomorrow, and we're going to work on working on I'm going to talk to you about some hip, knee, and ankle strategies, and we're going to work in your restroom on standing up and down, doing some toilet transfers. And then I'll work with you for your morning routine of actually going to the bathroom. We'll work on that together. So I'm going to give you some education and training on some hip, knee, and ankle strategies, and then we're going to implement those strategies while you go and use the bathroom. Would that be okay? Okay. Do you have any questions for me, Ms. Bertha?
No.
Okay. I'm going to do my hand hygiene here, and I noticed that the nurse is here already. I'm going to set you up though before I hand you off to the nurse, because I want to make sure that you're comfortable and that you can. I'll bring your lunch tray to you, okay?
Okay.
All right. Well, you've been so wonderful today. Thank you so much for your help, and thank you for participating in today's activity. I hope that it was meaningful to you. All right. I'll see you tomorrow.
See you.
Thank you. Bertha.
Bye.
Bye-bye.